We'll start with Rani Whitfield.
Good afternoon, everyone. Thank you, Mr. Jenkins, Chamber of Commerce, for allowing me this opportunity to speak to you all this evening. Again, my name is Rani. A lot of people say it wrong. It's spelled R-A-N-I. It's Rani Whitfield. I'm a lifelong resident of Baton Rouge, and I'm very blessed that I wear very many hats in this community. I'm a father. I'm a husband. I have two amazing children, guys, that keep me going day to day. I'm also a family physician, but more importantly, and I've been here 19 years as a family doctor, but more importantly, guys, I'm a public servant. My entire college and adult life has been spent doing some form of community service and commitment to my community. I attended University High School, and I graduated as a first through 12th grade senior. I attended University High School my entire life here. My mother and father, my mother Shirley Whitfield, my brother's here. My mother and father were very instrumental in influencing me in what I do and how I do these things in the community. My father actually volunteered and worked with Jewel Newman, the late Jewel Newman, and Richard Turnley during their campaigns. And he always talked to them about focusing on the community and servicing the community. And I remember one day in the car, he said to me, he said, "Son, you cannot impact nations until you start impacting neighborhoods." And that's what I've been attempting to try to do since I've been a physician. In junior college, while on the athletic, academic, vocal music scholarship, yes, I did a lot of stuff, I spoke to students on bullying and substance abuse. At my alma mater of Southern University right here in Baton Rouge, I started a program called Project Scientific Discovery, where I would go to Progress Elementary School every week for 2 years to talk to kids about health issues and to stimulate an interest in math and science in young males. While in med school, I spearheaded a program called Community Day, where the freshmen were inundated. They had to volunteer and service the children from the community once a year. And I've continued those things in the community of Baton Rouge, my sports medicine fellowship, and since I've returned here. I am very connected to the community of East Baton Rouge Parish. I've been on several boards, including but not limited to Southern University Board of Supervisors, Susan G. Coleman, Junior League Advisory Board, the Brave Board, and Senate-Corps. I work with Sharon Weston Broom on her transition committee. I've worked with Kip Holden on his HIV/AIDS task force. And I'm called upon frequently, guys, to speak to young people in our community, the elderly and young adults, as the hip-hop doc. So a lot of people are like, what the heck is the hip-hop doc? Why would you do that? Well, if you want to engage and make a difference in the lives of young people, you've got to meet them where you live. And not just the young people, but the older people as well. So I don't always stay in the office. I've left my office, I've left my families and my children on many occasions to engage and talk to young people about the things that are impacting them the most. We're losing our young people a lot to suicide, homicides, and accidents. The top 3 causes of death in our young people. And so that's what I've been passionate about and been focusing on. The hip-hop doc has talked about heart disease, substance abuse. On my dime and on my time, I've left my office and my family in many cases to talk to young people about things that can truly make a difference in the lives of how they're living. To impact violence, crime, suicide, heart disease, whatever the issue might be, I believe I have to meet people where they live. No matter the outcome of this election, guys, I'm not going to stop doing this. I'm very passionate about what I do and how I do it. I've even encouraged my band. I'm a member of a band before I played the bass in the band. I've encouraged my band to use their platform to talk about breast cancer, dyslexia. We played a gig at the Brighton School to raise awareness about these disorders that are impacting our community. Several years ago, a friend of mine approached me and said, "Hey, I have a friend that was committed falsely to a mental institution. What can you do? How can you help me?" I said, "Well, what was the situation?" So he gave me some background and gave me some details, but long story short, they were committed falsely, they were not evaluated quickly enough, and they remained in a mental institution for too long. And they ended up dealing with PTSD as a result of this poor treatment. And so this is something that they're continuing to have to deal with. So when you talk about the coroner's office and why I'm interested in running for the coroner, beyond being fascinated with the science of being a coroner, and it's a great field because much of what the coroner does is based on facts. We all have opinions about what happens in the community, what happens to people, but when you're dealing with the decedent, someone that has passed away, you're basing this information on facts when you present that to law enforcement or to whoever who might need that information. But my platform is going to center, guys, around a very robust engagement community like you've never ever seen in the coroner's office before. Most people still think that Hippolyte Landry is the coroner. Most people don't know who the coroner is, so I need people to know. And it's funny, but it's true. So we've got to be out, we've got to be present, people need to know who the coroner is. The three main jurisdictions of the coroner's office, most of us already know in this room, but I'll say it because some people don't, and I was surprised that people didn't know what the coroner did. Dealing with the manner and cause of death, dealing with the mental health of the individuals in the community, and dealing with sexual assault and trauma. But the coroner's office is so much more than that. I mean, the office can identify new trends in substance abuse, warn the community about an effective product that might be hurting children, and sound the alarm when there's evidence of the spread of infectious disease. Working with community partners such as Department of Health and Human Services, working with the Office of Public Health, working with law enforcement, organ donor organizations, to spread the word about health issues is the core, not just of my platform, guys, but as a physician of East Baton Rouge Parish. Through social media outlets, my administration will share statistics and data with the community in an accessible and user-friendly way. My administration won't just document health, or document death. We're going to preserve life by teaching us how to live longer and healthy lives, by preventing the diseases that are preventable: heart disease, stroke, diabetes. Focusing on resources to help our young people will also be key, and I mentioned earlier, homicide, suicide, and accidents are the top 3 causes of death in our young people ages 15 to 24. Listen, people, I'm very passionate about what I do. And I would admit this in front of you guys right now. I even teared up during the Lion King. I did cry. But I am on the front lines daily, diagnosing people with mental health issues. We have an epidemic when it comes to depression and anxiety. The economic issues in our community are causing a lot of people to come to my office that have considered or contemplated suicide. I've seen 2 sexual assault victims this month that were scared to admit what happened to them 6 or 7 months ago because they're scared to be ostracized by our community. And this is devastating not just them, but their families as well. It is an honor to be here, to be running. Any candidate in this room I have an ultimate level of respect for, because I never thought that it would be this way. I wanted to enjoy the process and think that it was gonna be fun. But I tell you guys, a lot of things happen behind the scenes that you guys don't, well, most of the people in this room probably know, but some of the people in the audience don't know. So it hasn't been as fun, but I think God is preparing me for something greater. And I just want to thank you guys for this opportunity. Hope you guys will consider me on your ballot. I'm number 118, Rani Whitfield, AKA the Hip Hop Doc. Thank you so much for considering.
Okay. Would you comment on that?
So your question, you mentioned opioids.
I'm Adderall. I've seen it affect people's lives, and I think in a negative way, and I just don't want it to lead to something else like an opioid addiction.
So I think the key to that is that there is some overprescription in the community when it comes to physicians. Adderall is a stimulant, can also cause elevated heart rate, weight loss, increase in your blood pressure. So that's responsibility is on the physician. We have something called a physician monitoring service that we can use. So if a patient comes in, you can check. And now it's allowed us to check multiple states to see if this patient is getting prescriptions from other doctors other than yourself. So that's one way we can circumvent that. There's also screens, but as a family practice doctor who sees individuals who request these medicines all the time, what I try to do is if I evaluate them and I'm on the fence and not sure if they actually have the issue, I'll refer them to a psychiatrist. So you have to get them in the hands of someone that's really trained to do that. There are screens for ADD to make sure these patients really require those medications. Of course, you have to have adequate and consistent follow-up, and I do see an abuse potential. People come in knowing that this stuff can cause weight loss, but they'll say they have ADD, and they know how to fill those forms out. So that becomes where you're relatable and have a good relationship with the patient. It's a tough call, but it's our responsibility to detect that.
Thank you.
Yes, sir.
Michael?
Dr. Whitfield,
Yes, sir.
will you commit to being a full-time coroner, or are you gonna keep the practice?
I'll commit to being full-time, just like Dr. Clark said, part-time equals full-time. If we weren't running against each other, anybody in this room could be a coroner. That's in the revised statutes. 2/3 of the coroners in our country are not doctors at all. So laymen can be coroners. And so what's beautiful about the coroner's office is they're having trained death investigators and a staff. I plan on having a transition team. Hopefully I can win this thing on the 12th. On the 13th, I go to church, and on Monday, I'm gonna be meeting with my transition team, which will include a forensic pathologist, as well as someone that served in a deputy coroner position to make a transition. If you look at the number of deaths and mental health issues that we're having in the community, it is hard. I don't know how anybody could do that job solely by themselves. So you have to have a very, very strong team to put together to address those issues.
You're gonna give up your family back?
No, sir. No, sir.
You're not
No,
gonna-
you don't have to give your family back. No, sir.
Dr. Whitfield?
Yes, ma'am.
I'm familiar with you from the community and some of the work that you've done with young people over the years. I'd like to know if you would continue, on occasions, your outreach to young people. outcome, because I believe that if you were seated as coroner, it may be helpful to keep some of those kids off the table.
Without a doubt, as I said in my talk, I'm not going to stop, successful or not in this election. Interacting with the community and engaging young people is what I do, and I enjoy doing it. And I think the only way we can make a difference is addressing our young people. We've got to start at the root. Those people are youth. Again, they're dying from preventable and treatable diseases. Homicides, suicides, and accidents are the top 3 causes of death in our young folks between the ages of 15 and 24. We've got to do something about it, and I don't plan on stopping.
Thank you.
I enjoy
I
it.
appreciate that.
Yes, ma'am.